Have you ever heard of Masseteric Atrophy Deformity, or MAD, especially after getting Botox in your masseters? If not, you're probably not alone. I'm not sure anybody's heard of it, because this is a term that I came up with and discussed in a previous YouTube video. However, some of the consequences of getting Botox or any other neurotoxin agent to the masseters is gaining awareness in the literature, and I was very interested to see the subject discussed in the most recent issue of Plastic and Reconstructive Surgery. If you want to learn more about MAD or consequences of Botox to the masseters, stay tuned. Hi everybody, I'm Dr. Jonathan Zelken, a board-certified plastic surgeon and a self-titled surgeon scientist in Newport Beach, California. I study the face in many ways in terms of surgery and other modern techniques and technologies to enhance facial contour, profile, beauty, and youth. And one of the more popular topics and frankly procedures in our practice is putting Botox or any other neurotoxin agent into the masseter muscles. The masseters are the muscles that clench and widen when you close your jaw and shut it tight. It starts at your cheekbone and ends at the jawline, and as you clench your jaw, it widens a little bit. So people who have something called bruxism or grind their teeth at night, or have other symptoms like TMJ pain because of jaw clenching essentially, will get Botox to this area. One of the positive side effects people found was that it actually narrows your lower face. So the posterior half of the lower face can be narrowed definitively with neurotoxin or Botox into the masseter muscle. It's pretty easy to do. It takes kind of a lot of units and you've got to keep up with it. So it's not the least expensive procedure we offer, but it's non-surgical, it's relatively safe, and it has an important impact on facial shape. So we do love it, but we do it so much that we notice that there are consequences. And in a previous video, I discussed one of these consequences on my own nurse, Mickey Omori. She has injected Botox to her masseters for some time now because she likes the effect it has on her facial shape. She feels that it gives her a more heart-shaped facial appearance and makes her eyes look bigger and is overall attractive. But the more you get it, the more you are weakening this voluminous muscle in the posterior half of the lower third of your face. And as you keep doing it, it actually starts to not sink in, but relatively speaking, will enhance or not change the tissues in this part of your face and give you a pseudo jowl if you don't have jowls, or worsen the appearance of jowls if you do. So I call this Masseteric Atrophy Deformity, or MAD. And the way I suggested treatment was to restore jawline continuity by strategically injecting filler along the jawline from the gonial angle to where the step-off is at the end of the masseter muscle. It only takes about 1 cc or so of filler to do it. It's an easy injection. And in a previous video, I suggested a technique to help. Now, the Chinese also came up with an answer, and their answer was a little bit more scientifically sound and studied than mine. In fact, it was published in the most recent issue of the Plastic and Reconstructive Surgery Journal, which is the #1 journal in our field and carries a lot of merit. Now, these Chinese authors talked about a series of patients that they treated, 27 to be exact, of typically older women who had neurotoxin or Botox to the masseter muscle to achieve more of a curvilinear or heart-shaped face. But if you have other facial issues like jowls or nasolabial fold shadows and things like that, I think it's easy to mistake facial flaccidity as a consequence of neurotoxic agents to the masseter. Now, the masseters are big muscles. I've sort of said that a few times now. And if you continue to cause them to atrophy, it does make a little bit of sense that that volume loss may actually enhance some of the flaccidity in your face. But what I would say to these authors is that neurotoxin agent injection, or Botox injection, in their case to the depressor anguli oris muscle and the top edge of the platysma muscle, is gonna, and these muscles all act to lower this part of your face by weakening them. Their thought is it causes this part of the face to come back up. Now, this is a technique I've seen even in American injectors and things like that. It's a popular technique, But I have, I guess you could call it cautious optimism, that that's going to be enough to actually correct jowls. If you get neurotoxin agent or Botox to the masseter muscles and you don't like nasolabial folds and jowls afterwards, the answer is probably not going to be as easy as putting in more Botox. My thought is that in these cases, and this is specifically in older women here, the issues of nasolabial folds and jowls probably pre-existed but become more manifest as we are creating this masseteric atrophy deformity. So the right answer, in my opinion, wouldn't be just to try and weaken the muscles. And even the befores and afters they show in their study are fairly subtle. The techniques that they use to grade the outcomes are not proven instruments. They're not validated at all. So I think it's kind of a weak argument, no pun intended. I will say that if you like the effect of Botox or any other neurotoxin agent to your masseters, but you're unhappy with subsequent jowls, and it's not enough just to put in some filler in the jawline, the next answer really is going to be liposuction or radiofrequency skin tightening of this area if you're younger and your skin will snap back, or in patients with advancing age, it's time to consider facelift. That way, you can have your cake and eat it too. You can get the narrowing effect you like, but then on top of that, to preserve that, you can also meaningfully enhance the jawline through platysmoplasty and facelift. I know it sounds like a lot, and it's not going to be for everybody, but it's an important consideration. If you think that neurotoxin agent is going to be enough to correct masseteric atrophy in an aging face, I think you have to have a little bit of cautious optimism too. I hope this sits well with you. None of these are life-threatening issues, and these are what we call first world problems, but it's an interesting topic, and I hope you find it interesting too. If you like this kind of discussion, please give me a thumbs up. Don't hesitate to subscribe. And if you want me to discuss other similar topics, please leave your comments below, and I will do my best to address them. Thank you so much.